February is National Eating Disorders Awareness Month. The month is dedicated to bringing awareness to all eating disorders and to educate people about when they should seek help.
Yeah, this is also a good opportunity to start what may be a difficult conversation. With us this morning is Dr. Deborah Michel, the National Clinical Director. Thank you so much, of the Virtual Care for Eating Recovery Center. Thanks for coming on this morning.
Thank you so much for having me to discuss this very important topic.
Yeah, no, so I said what may be a very difficult conversation because a lot of times the person going through it, whether it's yourself or someone else, they don't want to talk about it.
Exactly. And it's not unusual that if you do approach someone, we certainly recommend that it's a caring, kind conversation, sharing observations without judgment or coming to conclusions can be a helpful way to approach. You know, I'm seeing these behaviors.
Yeah.
And we can talk about what those are in just a moment, but there is a way to approach it, I think, that can be very helpful.
And certainly would probably depend on who this person is you're trying to talk to. Sorry, Sophia.
Yeah, and what are some of the common eating disorders that people are, struggling with?
Yeah, some of the common eating disorders that we see in treatment include anorexia nervosa, and that is characterized by individuals who are restricting their food intake, typically are losing weight, or for kids, they're not growing the way that we would expect them to grow for weight and height. We also see bulimia nervosa, which is characterized by binge eating unusually large amounts of food in a short period of time, and then doing something to compensate for those calories consumed. So exercising, self-induced vomiting, something of that nature. And then also binge eating disorder is actually the most common eating disorder, and it is characterized by binge eating without compensating for those calories consumed.
Oh, wow. Yeah, and that's the most common type.
The most common type, yes.
So we both have young daughters. When we talked about college students, but when do you typically see eating disorders sort of taking root or people starting this? I mean, how does it really start?
I have gone into elementary schools and started to have these conversations as young as 5.
What? Wow.
We start to see development of disordered eating at times. And it's very important for parents to be role models in what they're doing, because remember, the kiddos pay a lot of attention to what they see and hear.
They do. Yes, they do. What would you say are some signs that parents can really pay attention to and pick up on?
Certainly preoccupation with dieting, with fitness, with exercise, weight fluctuations. There can be evidence of food disappearing, finding wrappers, leaving the table after eating could also be a sign of a problem. And again, if a parent is concerned, sharing those observations in a kind, compassionate manner can go a long way.
Would you say that any eating disorder may have a deeper, maybe a mental health issue or reason, that it's just not about the food?
Absolutely. Eating disorders are genuinely not about food. They are considered serious mental illnesses and need thorough evaluation and treatment, but they are treatable. And so that's the message of hope. Get treatment.
Is it self-image? I mean, if it's not about the food, it's about trying to restrict your calories, or?
In part, it's about self-image. It defines sense of worth for individuals many times with eating disorders. There's a biological component as well, but primarily it's psychological.
Yeah.
And it fulfills a function, a psychological function for the individual. And that's why proper treatment is so critical.
What does that look like, proper treatment?
So proper treatment, certainly medical professionals, because there can be severe medical consequences from eating disorders. Certainly individuals, a therapist, as well as a registered dietitian who specialize in eating disorder treatment is critical as part of the treatment team.
What would you say to parents who maybe are on their kids a lot about, hey, I want you to eat healthy. Oh, you're eating junk. Why don't you grab something healthier? How should parents approach their kids and their teens on how to eat healthier without maybe giving them like this complex?
Sure, I think it's important, the language, the words that we choose, so that we're not dividing food into good food, bad food. All foods fit. Okay. It's a matter of balance and how we do that, and modeling as a family. What it means to be active, eating habits. It can be hard. We live in a diet culture, you know, to not fall into the trap of always being on a diet where, you know, spring break and in summer season, you know, fat talk is another big one.
Right, and they see so much of that
Yes.
on social media and online. Even if you're not having those conversations or saying those words, then they see it online.
Absolutely. I mean, it's what we call a hostile recovery environment, because there's so many messages out there about losing weight, looking a certain way. And so you think about the developmental years and those formative years, you're trying to figure things out. And this can become a way to feel like you fit in, to belong, at the cost of who you are as a person.
Right.
And that's the psychological part.
Oh, Dr. Deborah Michel, so much to unfold here and unpack. If folks want more information, where can they reach out to you?
Please contact our website, Eating Recovery Center, and we have all sorts of resources. Help is literally a phone call away. We offer complimentary assessments. We don't want that to be a barrier for people to get help.
All right. Dr. Deb Michel, thank you so much for coming on today.